in general, TANS devices, that it's not possible because the electrical signals would be affected. So some of the restrictions on our device include people with pacemakers, underlying, if they know they have a heart condition, or any open wounds in the skin area.
Okay, so I'm thinking back to possibly like rash or like patient discomfort. When you guys decided to put the wrap around the torso, because I'm thinking like it could possibly cause a rash like underneath your, like in your armpit area. Do you guys have like other ideas, or did you guys think of that when you guys were designing your project?
When thinking about the design of the brace, we thought about and considered many materials, but all of them, the ones that were in consideration, were meeting the ISO standard that we referred to, which my team Daniel is going to talk about.
So we followed 10993 ISO standard, which medical device material. Both neoprene and spandex are commonly used and are by literature like past that, as well as, while not well represented here, a person will be wearing a t-shirt while doing this, as well as probably thing. And well, yes, during our design process, we thought of any rubbing and tugging them a thing. However, this was the most stable design, and that ensured replicability not only during one therapy, but also from therapy to therapy, the person ending up in the same location.
I have a follow-up question, but if you want to add.
Yes, I was about to say that even though we revised the standards for each of the components that we assembled together, it's important to say that for the future, like my team at Braulio said, we're thinking about this project going further and having the 2 sensors and the shoulder brace as a whole thing, rather than 3 different components. When that's done, when that's the path that we're going forward, obviously the materials and the skin irritation needs to be reassessed, as it will be one brand new thing and not 3 components.
Okay. And then I have another question regarding the patent slide. So the first patent seems pretty similar. So can you guys describe the differences between your design and the first patent that you guys showed?
Yeah, they're one is like, you mean like the first one, right?
The very first one, yes. So I know it's a cylinder that's being wrapped around the arm and it has some similar holes.
Yeah, but these cylinder holes are related to the sensors. They're not related to actually electrode positions, and also like this is around this part of the arm and not actually about the shoulder.
So while it might look confusing, once again, the placement is different, and those holes are not to select the correct placement, so personalization is our main selling point here. It's just the same at very small, medium, large, and then it's the same 3 electrodes for everybody. The same can be said for this one. It's not like you choose where to put it, it's like there's electrodes there and everybody gets the same. Thank you.
Thank you.
Thank you, team number 3. I now call team number 4 to the stage. Team number 4, AmbuAir. Project manager, Milena Soto Rodriguez. Team members, Cyrus Amestica, Trevor Everglade, Samuel Metaye, and Lizette Avia. Faculty mentor, Dr. Sharon Ramaswamy. Alumni mentor, Ms. Oriana Cardenas. And this project is sponsored by Dr. Scott Schaefer. Let's give it up for team number 4. Team number 4.
Thank you. Good morning, everyone. My name is Emiliana Soto Rodriguez, and my teammates are Samuel Metayer, Trevor Everglade, Cyrus Almestica, and Lisette Avila. And today we're going to be talking about the design and development of AmbuAir, an oral airway device capable of maintaining an open airway in obstructive sleep apnea or OSA patients during moderate anesthesia care. But first, let me tell you a quick story. Imagine a scenario where a routine diagnostic procedure turns into a tragic tale of human error and technological limitations. In a private hospital in Panama City, Panama, a 62-year-old patient suffering with high blood pressure, obesity, and diagnosed OSA underwent a transesophageal echocardiogram. However, due to incomplete patient history and the oximeter's inability to accurately read hypoxia in patients with darker skin tones, the consequences were dire. During the procedure, the cardiologist observed bradycardia, and by the time proper intubation measures were taken, the patient had already suffered hypoxic ischemic encephalopathy. The patient spent 9 agonizing months in the ICU before succumbing to the aftermath. Our senior design project aims to address the current shortcomings in providing safe MAC anesthesia to obstructive sleep apnea patients. Join us in creating a solution that will ensure that every patient, regardless of their health condition or ethnicity, receive the care they deserve. Moderate anesthesia care is the first choice in 30% of all surgical procedures. It is also known as conscious sedation. It is administered through an IV. It can deliver multiple levels of sedation, and the patients remain breathing on their own, with an airway device in place that holds their tongue and opens their airway for the patient to breathe normally during procedure. The increased use of these type of anesthesia contributed to the 40% increase in outpatient surgeries in the past 10 years. We also know that OSA patients cannot safely undergo MAC anesthesia, and we still see an increase of 11.4 average annual increase in diagnosed OSA patients between 2010 and 2018. Therefore, these patients are forced to undergo general anesthesia, which does not only require specialized personnel, OR availability, and post-anesthesia care, but patients face up to a 16% chance of complications and up to a 0.8 chance of death, which accounts to over 1 million people. MAC anesthesia, on the other hand, has reduced side effects, faster cognitive recovery, and can be used in outpatient surgeries. The reason why OSA patients cannot safely undergo MAC anesthesia is because they experience airway collapse, where their tongue obstructs their epiglottis, which prevents the patient from breathing. This leads to hypoxia, and there's no airway device in the market that can maintain an open airway for these patients. And to put it in perspective, we have a 26% of men aged 30 to 49 suffering from OSA, and patients from 50 to 70, 43% of men suffer from OSA. Women have less chance of developing this condition. Besides gender, other major risk factors are obesity, diabetes, smoking, and alcohol consumption, where only a 10% weight gain increases the probability of developing this condition. In summary, we have an increasing number of OSA patients who cannot safely undergo MAC anesthesia, and an increasing number of surgeries choosing this type of anesthesia, which is why we predict a business opportunity in this market, which Tom will be explaining further.
Thank you, Emiliana. On the business side, we have a growing market to which our device would bring new audiences to the tubes and intubation accessories that take up to $1.08 billion in the global airway management device market. The project was to design and manufacture an oral airway device capable of maintaining an open airway in OSA patients, and was completed with a budget of $500. The design and development of AmbuAir was based on 5 market requirements. The device must protrude the lower jaw forward, be biocompatible, intubation friendly, must keep the mouth open, and it must maintain structural integrity during use. Now, we based our design on the best characteristics of nearly successful devices. These include the nasal and oral airways, whose limitations include lack of flexibility, inability to promote oral breathing, and neither was able to maintain an open airway in OSA patients. Keeping these limitations in mind, I will now pass it on to Trevor to go into depth about our design concept and our MVP.
Thank you, Zam. Our first design concept creates a pull force using the front portion of the jaw to pull the mandible forward and open up the airway. Our second design concept does this as well, except it uses a pulley system that is secured to a head harness to open up the airway. Now, do you remember the disadvantages that Emiliana showed us of MAC anesthesia? Do not worry, I'll remind you. They are frequent hypoxic episodes, challenging emergency airway management, and procedure interruptions due to airway maneuvers. Let us show you how our device, the AmbuAir, will minimize these issues. Our prototype consists of a gray jaw thrust controller that pulls the mandible forward and opens up the airway, adding an extra 30% to the airway space that allows the patient to breathe even better. It achieves this via teeth grooves that have an 8mm separation between them, where the frontal teeth are anchored to secure the device in place. It also has a stopper to act as an anti-choking hazard, and a component to quickly pull away the device in the event of an emergency. It is also angled such that it reads parallel to the patient's face, and it has room for the lower lip. The blue oval tube allows air to flow into the patient's airway, and it holds its thumb to prevent it from collapsing and choking the patient during surgery. And the dome expansion at the front tip of the tube creates a mechanical barrier to prevent the device from slipping into the patient's throat. Now, to see this in action, we have simulations. The force simulation on this side demonstrates the device's durability at the maximum possible bite force, which is shown by the green vector, and gravity with the yellow vector. However, this is the worst case scenario that could occur. The airflow simulation on the other side shows air flowing through the device at a rate of 12 liters a minute. This is twice the volumetric flow rate of a person at rest. That means that our device is more than adequate enough to provide airflow during surgery. Our prototype was printed using a Bamboo Lab 3D printer using 95A TPU filament. This material was chosen for its programmable flexibility and its ability to maintain structural integrity during use. Here you can see the parameters that were chosen to see just that, programmable flexibility and structural integrity. Now, I pass it on to Cyrus for verification testing.
Thank you. Our verification testing fell into the following categories. The first is dimensional testing to ensure that the requirements for protrusion and diameter are met. The second is kink testing to ensure that it will not prevent airflow when placed in a patient. The last is simulated use to test for the removal time. You may recall one of our market requirements included biocompatibility. Due to the fact that our device is made with TPU 95A, it would not pass biocompatibility standards due to its high particle shedding count. Instead, we leveraged the testing using a literature review on the future material of the device, which is rubber, and found that it is biocompatible due to its inert nature and hydrophobic surfacing. Therefore, it would pass the verification testing. To expand upon our verification testing, we use a one-sample t-test with a significance level of 0.05 to analyze our data. For the mean diameter of the mouth, we found it to be 6.5 millimeters with a p-value 0.00074. This is less than the significance level 0.05, therefore it passes the verification criteria. Next, we found the mean protrusion to be 9.9 millimeters with a p-value of 0.007. Therefore, it passes the verification criteria. Next, we found the mean removal time to be 4.9 seconds with a p-value of 0.000059. Therefore, our device has passed all of its verification testing. As our device has passed its verification testing, we now move on to analyze its cost. The cost of one unit is $21.68, with an at-scale price of $4.18. This is based off the maximum units that can be printed on one printer plate, which is 6. As our device is meant to be used during surgical procedures, regulatory assessments are necessary, which Sam will explain further.
Thank you, Cyrus. The device is class 1, meaning it poses a low to moderate risk to the user. An oropharyngeal airway is a device inserted into a patient's pharynx through the mouth to provide a padding airway, and is 510K exempt. Relevant standards are listed behind me. Focusing on a more global perspective, nearly 39 million adults in the US alone are diagnosed with OSA. The sad reality is that this accounts for a mere 20%, as an astounding 80% remain undiagnosed. When the risk factors are paired with underlying health condition, this makes it almost inevitable that OSA patients will undergo surgery. Continuing the global trend, patients that undergo MAC recover within a day, in contrast to those that undergo general anesthesia, which typically prolongs recovery by up to a week. Not only is MAC less time-consuming, it is also more affordable, with an average cost almost $3,000 less than that of general anesthesia. Not to mention, 29 million OSA patients lack access to health insurance and will be paying out of pocket. Ambulair gives these OSA patients previously unable to undergo MAC anesthesia the chance to do just that, while boasting adaptability and user-friendliness. Our model consists of a unique jaw thrust controller to induce protrusion, specialized T-grooves to secure the mandible in place, and several other key features to provide a more efficient method overall of securing the airway. In the future, removing the rounded ends will maximize airflow. Rubber casting will be the optimal manufacturing process, and adding more sizes would accommodate for more patients. A special shout out to our fabulous supporting group consisting of our sponsor, Dr. Scott Schaefer, our alumni mentor, Ms. Oriana Cardenas, our instructor, Dr. Michael Christie, our faculty advisor, Dr. Sharon Ramaswamy, and Ms. Claudia Estrada. Last but not least, a special shout out to you members of the audience, both in person and remote. Thank you for being here today and helping us conclude this fall 2023 Biomedical Engineering Senior Design Expo. Have a blessed day.
Thank you, team number 4. I'll pass to the judges.
Great job, guys. So I have a quick question. In terms of manufacturing, and is it going to be disposables like single use? And also two, how are you going to sterilize this before, being placed in packaging?
Yes. So currently, our design was printed in 95 ATPU, but that's not the ideal manufacturing process. For commercialization, we're going to go for rubber casting. These are single-use devices, meaning we're going to use them in one patient and then dispose of them. They would probably be as packaged within a pouch that could be sterilized with 2 times ETO, or further, we would go into more research about sterilization standards for packaging. For now, the scope of the project was to create the prototype.
When you did your testing, did you do your testing based off of the material that you used for the prototype, or did you guys do testing for the material that you guys plan to actually have your product for?
In terms of verification testings that we conducted, that were the diameter for the mouth opening, the king testing, we performed it on our 95 ATPU, which is, showed that the king testing was very, sorry.
Yeah, go ahead.
Oh, yeah, we were able to use, yeah. It showed that the material was very flexible, which did not interfere with the structural integrity of the device. And for the material, we did biocompatibility testing that my teammate Cyrus is going to be talking about.
But to reiterate from your fact, we use TPU 95A because it showed similar properties to rubber and why we're going to be using it. And the reason we didn't conduct it first with rubber is to first make sure, with of course cost, because manufacturing with rubber is more costly. And first we had to make the simulated mold, which is this device, and that's why it's TPU 95A. Sorry. But yes, and then for biocompatibility, we're leveraging it using the future material since we're not creating a new material. And so the standard that we chose was to particle shedding count because it's going to be inside the oral cavity. So that's why rubber, when we're doing literature review and focusing on rubber because it's the future material, it is biocompatible in that sense.
Any other questions?
No further questions, but are you guys glad it's over?
We're actually excited. This was an honor to be able to present.
I'll give you a tip. You're never gonna end senior design. It's gonna be with you for the rest of your life.
Yes.
Just let you guys know.
Thank you.
Thank you, team number 4. At this time, our judges will retire to EC 2680, EME conference room for deliberations. You will also be joined by a remote judge there on the Zoom link that has been provided. So please, judges. Members of the audience, please remain with us. This is an exciting part of the program. And just sort of a look in the rear view mirror of what we did this past semester. So please stay with us. The award ceremony will take place promptly at 10:45 a.m. will be the award ceremony. Please remain with us if you can. Thank you.
That's why
I witnessed.
What's your name?
Thank you very This is part of the lesson for her life. I am very Thank you ¿Qué felicitas? Mira,
Hicieron